Did you know that how much time your doctor spends with you and how thoroughly they explain your options might directly affect not only your outcome, but their bottom line? Today, I'm pulling back the curtain on a part of AFib care that few people talk about. I'll show you how ethical, patient-first care can actually cost electrophysiologists money and how that affects the treatment you get. More importantly, I'll show you what to look out for so that you can protect yourself and get the care you truly deserve. When I see a new patient for atrial fibrillation, I usually spend about an hour and a half, sometimes even more. I take the time to understand their symptoms, their medical history, their lifestyle, their goals, and I walk them through all of their treatment options, pros and cons, including not doing a procedure at all. But here's the truth. Many EPs spend just 5 to 10 minutes on a new consult, and yet we both still bill the same. The difference? They can see 3 to 4 times as many patients in a day. If I see 8 new patients, they might see 24. That's a huge difference in revenue. I've spent over 20 years in this field, and I can't tell you how many times I've seen this firsthand. I've watched EPs literally walk into a hospital room for an EP consult for AFib, speak with the patient for 5 minutes, never ask about symptoms, and then just tell them flat out, you need an ablation, and you need it before you leave the hospital. That patient leaves thinking that if they don't get it, they could die. No discussion, no choices, just pressure. That's not ethical medicine. That's production line medicine. Now let's talk about what happens next. When I fully explain treatment options, including lifestyle, rate control, rhythm control, medications, and ablation, some patients choose ablation, but many don't, and that's okay. Only about 20% of my new patients end up having a procedure, and that's because it's the right fit for them. But in some practices, the conversion rate is 90%. Everyone is told they need an ablation, whether or not it's appropriate. Patients are scared, rushed, or not even told they have a choice. And I've seen it go to the extremes. I once saw a patient with stage 4 pancreatic cancer, probably less than 6 months to live, statistically, who somehow had been convinced to get an AFib ablation, instead of just managing the rapid heart rate with medications or focusing on comfort. Instead of doing that, the EP pushed them into a procedure, and it didn't even work. They didn't even do a very good job. The patient was still in AFib afterwards with a rapid rate of like 140 beats per minute, but the EP walked away with a paycheck. This is not about technology, it's about intent. Let's look at how the actual procedures are done. So for example, when I perform an AFib ablation, especially for persistent or long-standing persistent AFib, the later stages, I block out 4 hours. I mean, I need the whole 4 hours, but I will block out 4 hours and do whatever is necessary, whether you need the whole 4 hours or not. So I can do even very complex procedures on all 6 walls in one sitting. So I actually map the atria carefully. I go beyond simple one-wall pulmonary vein isolation, and I address other walls like the posterior wall, roof, mitral valve isthmus if necessary, left atrial appendage, right atrial appendage, coronary sinus or floor, anterior wall. Everything needed to give the patient the best chance at staying in normal rhythm long term. As a result, I get durable success rates in over 90% of my cases, and I rarely have to do a second procedure, and I almost never do a third procedure. But other EPs may only do a simple one-wall pulmonary vein isolation, often using newer technologies like the newest pulsed field ablation that isn't any more effective success rate-wise, but is significantly faster. So they're in and out in 45 minutes to an hour, maybe hour and a half, and that lets them do 3 to 6 ablations per day. I don't do more than 2 ablations a day if I'm blocking out 4 hours, so by doing it the other way, in and out, that's fast, high volume, high revenue. But those simpler ablation lesion sets often aren't enough, especially for the more advanced stages. And guess what? When the AFib comes back, guess who does the redo procedure? That's right, the same EP who did the quick, incomplete ablation. And then they just tell you, well, that's just the way it is. Everybody needs that, which isn't true. So what does this mean for you? It means you have to ask questions. It means you have to do your homework. Here's what I recommend. Ask your EP how much time they spend on new consultations. Ask how thorough their ablation strategy is. Do they treat more than just the pulmonary veins, especially in the more advanced stages? Ask how often their patients need a second or third procedure. Don't just go with the EP your cardiologist refers you to. That may be their friend or colleague or their buddy, not necessarily the best person for your case. Be willing to seek a second opinion, even pay out of pocket if necessary, if it means getting truly ethical, high-quality care. Because here's something I've seen again and again over my 20 years of private practice. I'll ask a new patient, do you know why you had your ablation, or your pacemaker implant, or your defibrillator implant? 9 times out of 10, they say to me, no, I don't really know what this was for. My doctor just told me I needed it. There was no education, no shared decision-making, no clarity. That's not how medicine should work. Now, I'm not saying that all high-volume EPs are unethical. What I am saying is the system unfortunately rewards speed, not depth or quality sometimes. And ethical care, the kind that puts you first, takes time. And in today's model, time is expensive. But you can change that by being informed, by asking questions, and by choosing quality over convenience. If you found this helpful, please like us, subscribe, or share this video with someone you care about. Let's make heart care better together. For everything atrial fibrillation related, please feel free to go to my website, drscottlee.com, where you're going to find more resources and also can follow me on social media.